The Indian government is urging its citizens to follow a people's curfew and stay at home as the number of COVID-19 cases nears 200. In a national address, Prime Minister Narendra Modi announced a single-day voluntary lockdown this coming Sunday.
Well, the Indian government is facing accusations of failing to conduct enough tests. And so far, those who have recently returned from an international trip or been exposed to a positive case are being screened. Neha Punia has more.
This was the first time that Prime Minister Modi spoke on COVID-19, nearly 50 days since the first case was reported in India. Prime Minister Modi used his speech to underscore what an important health emergency this is, urging Indians to self-isolate and not step out of their homes unless absolutely necessary or if they work for any emergency services. The Prime Minister said there are many Indians who are going about their daily routine, attending mass gatherings, using public transport, and his message was important because he said there are many who think that the virus won't affect them. He tried to dissuade them, saying that that's not the case. He warned that this is a misconception and that the only way to curb the virus's spread is to curb your movements. He's also made an appeal to all 1.3 billion Indians, requesting them to undergo a self-imposed voluntary curfew all day on March 22nd.
22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है। इस जनता कर्फ्यू के दरमियान कोई भी नागरिक घरों से बाहर न निकले।
While this curfew is not mandatory, experts believe it could be a trial run for a nationwide curfew to be imposed in India in the days ahead. The Prime Minister also urged Indians to not hoard food items. In different Indian cities, food and essential products are flying off supermarket shelves. Mr. Modi said that his government will ensure that there's no shortage of supplies and that citizens must not indulge in panic buying. Prime Minister Modi also announced the formation of a COVID-19 economic task force, which will be headed by the country's finance minister. This group will take steps to mitigate the impact of the crisis on India's economy that's already growing at a 6-year low and grappling with a 4-decade high unemployment rate. Meanwhile, the government has expanded the scope of its partial lockdown. Starting March 22nd, no scheduled international commercial passenger flight can land in India for a week. All of India's 29 regional governments have been asked to ensure that private sector employees work from home. The central government also slashing its workforce by half and urging the other half to come into work on alternate weeks. But many have criticized Prime Minister Modi for not addressing the questions of why the government is not testing everyone, and also concerns about India's healthcare infrastructure. India spends less than 4% of its $1 trillion GDP on its public healthcare setup. Most state-run hospitals are overrun and there aren't enough doctors, and many experts are warning that if there is a mass outbreak of COVID-19 in India, the country is perhaps ill-equipped to handle a crisis like that. Neha Punia, CNA, New Delhi.
We start our program with India this Tuesday, which will begin the world's largest lockdown. That's 1.3 billion people. Prime Minister Narendra Modi made the announcement in a televised address while pledging $2 billion to bolster the country's frail health system. So far, health officials have reported 469 active cases of COVID-19 and 10 deaths. Let's now cross to our correspondent, Mandakini Galat. She's standing by in New Delhi. Mandakini, thanks so much for being with us. What's the latest that you're hearing about India amidst this crisis?
An extremely strong speech there, Sanam. The Indian Prime Minister telling 1.3 billion people that there's a total ban on coming out of your homes starting midnight today. Now, he said that every district, every lane, every village will be under lockdown. And if you can't handle these 21 days, then this country will go back 21 years. Now, he said very clearly that India does not have the resources that many of the nations that are facing an outbreak have. And of course, he didn't go into the numbers, but we've been hearing them recently. For example, India has only one government doctor for every 11,000 people. only one isolation bed for every 84,000 people. The situation is bleak, and you have a prime minister taking what many health experts here believe is the only step, which is to ask people not to step out at all. Of course, this started with a one-day curfew on Sunday when the Prime Minister requested all Indians to stay at home. Nobody quite knew what was coming. We were able to go out on Sunday, and while most people respected the curfew, we did see quite a bit of activity out on the streets, and we also got similar reports from other cities across the country. Now, today in particular, there was a lot of panic, people rushing, trying to get supplies since the Prime Minister announced he would be addressing the nation. Already we're seeing shortages of essential items like food. So it remains to be seen how effective this lockdown will be, how well enforced it will be. But certainly a tough few weeks ahead for India and her 1.3 billion people.
Mandakini, you just mentioned India doesn't have the resources to tackle this pandemic, and you've been speaking to people. There's already a real sense of panic in the country, isn't there?
Absolutely. Most of our cities are full of migrant workers, laborers who come and work in the cities, build the cities, live in makeshift shelters. For the last 2 days, and especially today, they've been trying to go back home to their villages, but they can't find that. There are no buses, the borders are sealed, there are no trains, and even if they could afford it, there are no flights. So there's just a lot of people who are stuck in cities with nowhere to go, and the Prime Minister just told them to stay where you are. Now, the problem is that for a lot of these people, they don't have anywhere to stay where they are. They don't have homes. So there'll be a lot of people sleeping out on the streets, and the government is building makeshift shelters for the homeless. We met a few homeless families on Sunday. They did not even have, for example, soap. The government, of course, was going around trying to distribute soap, teaching people how to wash their hands. You have to understand that the Prime Minister in his speech today and the government in their efforts are speaking to a lot of people who are uneducated, who don't have access to anything beyond the daily wage that they get. So even things like you need to wash your hands is not something that's really well understood or well known. So a lot of panic. It's hard to deny that the supply chain is going to be broken. It's going to take a while for India to figure out how to get food and other essentials to people. And of course, the Prime Minister was quite vague in his speech about this. He said the government is going to try to help the poor, but did not outline a plan. So the next few days are going to be a real test. In fact, the next few weeks.
Mandakini Galat there with that worrying update from India, where 1/5 of the world's population has now been placed under lockdown.
India has become the latest and largest country to introduce a nationwide lockdown in the fight against the coronavirus. Its population of 1.3 billion has been told to stay at home. The country has so far seen about 560 confirmed cases and 11 deaths. And there are fears that infections could spread quickly in densely populated urban areas. Crowds formed at pharmacies and shops shortly before the midnight deadline. Non-essential businesses have been closed, most flights and rail services have been stopped, and the busy Bollywood film industry has ground to a halt. Indian Prime Minister Narendra Modi said without the 21-day lockdown, the country could be set back 21 years. So let's join DW correspondent Nimisha Jaiswal in Delhi. Welcome, Nimisha. Are people abiding by these new restrictions?
Well, Phil, to a large extent, yes. People have not been coming out on the streets as much as they normally would have. The Sunday voluntary curfew was hugely successful, with reports of millions staying put. It's not quite as empty on the streets right now because people are allowed to step out to get essential services, but there are police checkpoints across the city that are preventing people who are not either rendering or accessing essential services from stepping out. However, it is also important to think about the fact that there are many amongst the urban poor who are actually trying to get back home. Now, transport services are largely shut down, buses, trains, as well as flights. However, many are still trying to make their way back to their home states because they're daily wage earners and they cannot sustain themselves. They cannot afford life in the city anymore. And we went to find out how exactly these people are managing walking large distances in their efforts to get home, even though borders are closed. This is the report.
These people are violating a lockdown. Delhi has closed its borders. No buses, trains, or flights can leave. Yet, these migrant workers are determined to get home. Many earn just a daily wage. And with businesses shut, they cannot afford life in the city anymore. With public transport reduced, Devraj has walked many kilometers with his family, putting them at risk of exposure. He's scared, but he says he has no option.
They aren't letting me work. That's the problem. I have young children. They're hungry. Who do I ask for help? We've been struggling for 4 days.
The Delhi government has announced some relief measures for the poor. But these workers don't feel reassured.
I can wait to find out if the government will give me money. But how am I supposed to eat until then? And what if they don't?
Away from the bus stop, the city lies deserted. Those who can afford to are staying home. Checkpoints like this one have been established across the city. The police is ensuring that only those who are rendering essential services are allowed to be out. The government has also said that violators of the lockdown can face legal action. Grocery stores remain open. Some are only allowing a limited number of shoppers in. This one says masks are necessary, as is sanitizing your hands before entering. India has been paralyzed by these measures, but health experts are throwing their weight behind the lockdown.
If India can fight this together for 2 weeks, we definitely would have prevented the curve from going up and made it flat. All that we need to do is to prevent the curve from going the Italy way. Because if that happens in India, the results will be much worse than what happened in Italy.
The Indian Prime Minister has appealed to migrant workers to stay put and avoid infecting their families back home. But for many, that risk is far more distant than being trapped away from home during this lockdown.
Nimisha, the poor always suffer worst in these crises. Tell us more about how the government is trying to help these migrant workers.
Well, Phil, the government has formed an economic task force with the finance minister at its helm to find out exactly what would be the best route forward to address the economic crisis that is sure to beset the country as a result of this lockdown. Just yesterday, some regulatory and fiscal measures were announced. In addition, the government has asked all states to send funds to add money to the bank accounts of construction workers, one of the main constituents of the daily wage workers. But they are not the only ones, and we would have to wait and see how exactly the government is going to ensure that in the midst of a lockdown, officials can still make their way out and ensure that these daily wage workers and the poorest of the poor in the country are continuing to get meals and sustenance during this lockdown.
Thanks for that. Nimisha Jaiswal in Delhi.